became the first victim of this deadly disease in Malaysia since 1992. So Malaysia's National Immunization Program, also known as NIP, started in the 1950s, has done incredible work. It provides free vaccines to protect children from deadly diseases. From the National Health and Mortality Survey 2022, yet as of 2022, there's still 1% of children aged 12 to 23 months remain completely unvaccinated, and 12% receive incomplete vaccinations. This isn't just a statistics, it's a growing gap in protections. Why? We should ask us why. The main barriers are geographic and socio-economic. Rural and underserved regions, especially in Sabah, Sarawak, and migrant communities, struggle with limited access to healthcare, lack of infrastructure, language barriers, and vaccines cold chain issues. These children are being left behind and in a very dangerous situations. If we do nothing, the risk of outbreak increases, healthcare system become overstressed, and inequality will be widened. Preventable diseases may resurface stronger, deadlier, and costlier. Vaccinations shouldn't be a privilege tied to your postcode or status. Every child deserves protections. So how do we fix this? We don't wait for people. Okay, we will be the one who bring healthcare to the people. I propose a nationwide mobile vaccination program led by the Ministry of Health in collaboration with NGOs and local governments. These mobile units will reach underserved areas, supported by community outreach, education, and engagement with local leaders. Implementations will involve scheduled visits and integrations with existing local services. What made this unique is the combination of mobility and community empowerment, not just one-off drives, but sustained healthcare embedded in the community. It's a scalable, starting in the most affected regions and expanding nationwide, and sustainable, backed by existing infrastructure and partnerships. The NIP has laid the foundation. Now must be stronger and higher. Let's ensure no child is left behind, not by distance, not by language, and not by bureaucracy. Join the movement, support the call for a mobile vaccination initiative, talk about it, share it, push for it, because a healthier Malaysia begins with every child protected, empowered, and of course, be vaccinated. Thank you.
Okay, thank you, first presenter. Well done. Okay, now you can be relieved. All right, so let's proceed with the second presenter. Before that, just to let you know, I'm the one recording. Okay, so after this, wait for the recording to settle down. Okay, on Teams, then you can download it and upload to YouTube. Okay, and after that, you post the YouTube link to UKM for your submission. All right, so let's continue with the second presenter, please, whenever you're ready.
So good evening. I am Lau, the second presenter. So have you ever wondered how dangerous vaccine hesitancy can be? So let me take you back to the 2019 measles outbreak among the Orang Asli Batik community in Kolakor, Kelantan. So 43 of them were infected and 15 died. So these were not just numbers. They were mothers, fathers, and children. So the whole families were torn apart by something preventable. So what caused this tragedy? A simple and devastating fact is the low immunization coverage. So Malaysia's National Immunization Program provides vaccine free of charge, but the uptake is still voluntary. And increasingly, misinformation on the internet is eroding public trust in vaccines. Many parents delay or reject vaccination, putting not only their children, but newborns, the elderly, and immunocompromised individuals at risk. Post-pandemic, we saw the consequences. Pertussis cases rose by 818%, diphtheria by 80%, measles by 63%. These are not coincidences. They are directly results of decreased vaccination among the residents during lockdowns. So we need to act. This is not just a medical issue, it's a public responsibility. That's why I believe Malaysia should make childhood vaccination a legal requirement for school entry. Other countries like Australia, Italy, and parts of the United States have done this. With proven results, we can also do the same by revising the Education Act to require vaccination records during school enrollment. We should also update the Child Act 2000 to declare vaccination as every child's right. We should also establish a national immunization registry to monitor and track resident vaccination coverage effectively. This requires collaboration between Ministry of Health for vaccine access and exemptions, Ministry of Education to enforce school entry rules, and schools to check vaccination status, and the most importantly, parents. Only those with legitimate medical exemptions verified by the doctors, the children would be excluded from vaccination. This proposal is ethical because it protects the children. It is also legal because it aligns with existing child protection laws. And it is practical because it integrates vaccination into school enrollments across both urban and rural areas. By doing this, we can push our vaccination rate above 95%, achieving herd immunity and preventing future tragedies. So let's work together, doctors, nurses, teachers, and families to ensure no child is left unprotected. A healthy school means a healthy Malaysia. Let's make that our legacy. Thank you.
All right, thank you, Yao Qing, for the presentation. On to the last speaker from Group 5. Okay, whenever you're ready, you can start.
Good afternoon, Miss, and my perspective is from the parents. Okay. Imagine holding your newborn in your arms, the very picture of innocence and vulnerability. You do everything to protect them. But what if a simple decision from another parent puts your child at risk? In Malaysia, childhood vaccination rates vary drastically depending on region. According to a research in 2025, the parental refusal rate of vaccination in Malaysia ranged from 0.08% to a shocking 42.5%. Vaccination has long been recognized as one of the most effective public health interventions. Malaysia's National Immunization Program, NIP, provides free vaccines to all children. However, an alarming trend of vaccine hesitancy is emerging, especially among young or first-time parents. Misconceptions about side effects, distrust in health authorities, and exposure to anti-vaccine misinformation on social media are some key reasons behind this delay or refusal. From a parent perspective, many hesitate not because they don't care, but because they lack access to accurate, clear, and reassuring information. Unfortunately, if it is not addressed, vaccine-preventable disease will continue to rise. Hospital admissions will increase, and the trust in healthcare system may deteriorate. The long-term consequences including potential school outbreaks, increased healthcare costs, and even preventable death. To bridge this gap, I propose the mandatory integration of vaccine education into all pre-parenting and antenatal care sessions, especially during government-run marriage preparation courses and prenatal checkups at the health clinic. Additionally, each school can run annual vaccination catch-up campaigns with informational sessions for parents to expand vaccine safely. What sets this solution apart is its sustainability and reach. It leverages existing national infrastructure such as marriage courses, prenatal clinics, and schools, all of which already engage directly with parents. In conclusion, let's start with a conversation. If you are a parent, ask your clinic about childhood vaccines. If you are a student, start a discussion in your campus about vaccine safety. And if you are an educator or policymaker, support initiatives that bring vaccine education to every Malaysia household. Thank you.
All right, thank you, Yang Jie. So that marks the end of the presentation and the idea pitching assessment for your group. Thank you so much for group 5. Now you can take a sigh of relief, okay, and you may leave the meeting, okay? Enjoy your day. Bye-bye.
Thank you, Miss.
Thank you,
All
Have a
right.
Miss.
nice day too.
You're
Bye-bye.
welcome. Bye.